challenge to deliver patient care, especially with the strict implementation of the new infection prevent and control procedures since the COVID-19 pandemic. Every office must comply with the digital screening, aerosol-generating procedures, and rigorous documentations of every procedure done. These procedures must be followed to reduce the risk of COVID-19 transmission. That's why it is absolutely critical for dental practices to implement the best infection prevention and control procedures to help protect the patient's safety as well as your staff. In 60 minutes, in the 6-minute webinar, you will learn the critical information that will protect your dental team and your patients against infections while reducing the risk of disease transmission in the office. Thank you everyone for attending today. Good evening to you. And we have another great webinar today from Dentistry Business. We are live on Facebook, YouTube, LinkedIn, and now we are even on Eventbrite. So we will post our Facebook link there in the chat area. So if you share this on your wall, all your friends, colleagues will be able to watch this live as well. So we want to do a quick introduction about Dentistry Business. We are an online education platform for the dental industry. We strive to to invite different speakers and specialists in helping dental practices survive and thrive during the post-COVID-19 pandemic. We started these webinars in April, and we've already booked until the end of August. So we have a lot of great content. You can also now watch on demand any of our webinars by going to dentistrybusiness.com. And if you receive a promo code for today's webinar, either from us or from any of the speakers, you can use those to watch recorded webinars as well. So I just posted the link there to the Facebook. So share that link and they will be seeing what you're seeing right now. And just a quick introduction about me. I'm Sharky, CEO of Dentistry. We are a result-driven dental marketing platform and marketing services that apply analytical and data-based approach to increase new patient acquisitions. Basically, if you use your technology with the same span, you could increase your patients by 50 to 400%. I also teach a course at the University of Toronto, the Dental Marketing and Social Media Fundamentals course. And I want to introduce our two great speakers for today. We have Joan Hutchins. She has 35 years of experience in the healthcare environment as a registered nurse, surgical suite specialist, and an epidemiologist. With her academic background and extensive clinical experience, she is an expert on infection prevention and control practices. As a registered nurse and surgical suite specialist, Joan was the director and clinical instructor of the operating room technique and management program, a hospital-based surgical program. As a clinical consultant, she provided consulting services and audits to hospitals, outpatient clinics, independent health facilities, and dental offices across Canada. As an epidemiologist, Joan co-founded S.A.F.E Dentistry, Inc., which assists dentists and staff to deliver quality, safe services in compliance with the IPAC standards and best practices to minimize the risk of infection and disease. And next, we have Dr. Archer, who is the CEO and founder of Archer Dental Corp, with 3 locations in Toronto, Canada. She's also the past vice president of the Royal College of Dental Surgeons of Ontario and an experienced dentist who received her Bachelor of Science and her Doctor of Dental Surgery at the Dalhousie University in 2001. Natalie's core interests includes geriatric dentistry and raising awareness for dental elder abuse. She also became interested in infection control and the new IPAC guidelines to protect patients and help dentists and their teams provide excellence in their daily operations. As with all health services, safety is paramount, and her interest in safe dentistry comes from her passion for delivering high quality dental care without compromise. So thank you for joining us, Joan and
Thank you.
Dr. Archer. When I got into the industry, I actually met Dr. Archer about 10 years ago when I first got into the industry. And I remember she was telling me about an audit about how the standards for dental practices wasn't high. And she said that, I should go in and do an audit of these procedures of dental offices. And she told me that I should do it. And it was a great idea. I agree it was a great idea, but I didn't end up doing it. Now, 10 years later, it's perfect timing. So she somewhat predicted the future back 10 years ago.
Yeah, so thank you for that. I do remember the convention there, and it's true actually how Joan and I came together was actually through Global News. And I think for all the dentists and dental people watching, we may remember not too long ago, around 2 years or so, when those IPAC guidelines first came in. And it was very stressful as dentists because it's very new and very different from our own RCDSO guidelines, which we were following. And we all may remember when we heard of dental offices being closed, infections, and so that's sort of how safe dentistry, if you will, was born. Sharky, I may get you just a slide to the next slide if you don't mind.
Sure. And just a note to everyone that's attending here, please, if you have any questions, enter into the chat. If you're on Facebook, YouTube, LinkedIn, or Eventbrite, enter in the chat there. So we're watching everything. And at the end of the webinar, we will bring those questions up to Joan and Dr. Archer.
Yeah,
Right,
great.
go ahead.
Thank you. And we definitely want to answer any questions or assist in any way. So as a frontline worker, as a dentist, practicing for almost 20 years, not to give away my age, but, it's hard wearing many of the hats. It's wonderful being in the trenches. Now with everything going on pre-COVID, you can imagine all of the very different processing, documentation, responsibilities we have as control officers, people in our and this COVID time, of course, now safety, or the word safe, more important than ever. I actually love the name of our company called S.A.F.E because that's really what we're all about. We want you to feel safe. We want to keep your team safe. We want to keep your staff safe. We want to make you better. And, I'm just like all of those other dentists out there where infection control was definitely not my expertise. I probably was one of the teachers that did not know how to sterilize in dental school. And it worked that way. Now the responsibility is placed on us. Probably appreciate firsthand now how important it is to kind of go back and understand the basics so that we can ensure that our team members are following proper procedures. We can check, we can quiz, and keep everybody safe. And I think now I can speak firsthand, getting back into the office, how wonderful it is. And I really don't want to close the offices again. And so keeping our office safe is really what tonight's focus is all about. So if I could do the next slide for us. Thank you so much. What really makes our team special, I think, is our 50 years combined. I mean, Joan is fantastic at Wikipedia. That I did not know. She has grown my brain in the last, several months or years or so since we've been putting this together. And I think, having our combined clinical experience make our consulting team really unique. And I'm really proud about it. And I think the words that you used earlier tonight was minimizing risk. Really what we're all about here. And we want to try and make it as simple and maybe a little bit even repetitive, if you will, so that, just get like second nature, like putting your gloves on, taking your gloves off. now the donning and doffing all means the doctor is designed to
So, Dr. Archer, sorry to interrupt. So I think we have a sound issue. Maybe try turn off your video. I think the connection is a little bit slow. See if that helps with the sound.
Can you hear me now?
Yeah.
Okay. Maybe I'm talking quickly.
Oh, okay. Yeah. Now it's perfect.
It's been known before. If you could go to slide 4 for me there, Sharky. I want to talk a little bit about the RCDSO and the standards and our IPAC guidelines. You know, this is the stuff that, you know, us dentists, we get scared about. We see the word RCDSO, we see the word IPAC. You know, these are different things for us because we're so focused on dentistry. And the I have to say, in my 20 years, has never been like before. You know, not only are we in charge of marketing and being an employer and keeping everybody safe, now all of these all of these new procedures and, you know, different digital equipment in the market, and trying to ascertain whether these are good things for our team. How can we be sure if we're not in the office tomorrow that our team is working properly, that we know that if an audit was to go in, or perhaps, you know, an unfortunate inspector or something coming in there, how do we know that we're following protocol? So that's really what this program is a little bit about. The impact on all of us is huge, in the sense that if a dental office is in the media or closed because of infection control, it doesn't affect, you know, my office or your office, it affects the dental profession. And so, you know, our RCDSO guidelines are recommending to use an external consulting service like S.A.F.E Dentistry or another one out there. For the purpose, it is an external consulting service. It is an external program trained to get you and your team, you know, continually on board. And one thing that I have learned firsthand, and I'm extremely humbled, is the fact how, I'll be quite frank at the beginning, how poorly we actually rated when Joan came into our offices on things. And it wasn't necessarily that we didn't have things intact. It was team members didn't know how to answer questions. So, you know, if Joan is an inspector or an auditor coming in and she's going to ask someone to show them how to use the eye wash station or where a certain manual or a binder is, she's going to expect how to check the control office, or any other team member is going to know where they are. I learned a lot through the program and the process personally, which has been amazing. And that's what I really want to share with all of the dental offices out there. If you could turn to slide 5 for me there, Sharky. Reprocessed sterilization definitely is in the media. We've seen some dental offices where that has been that's been shown, and that's definitely an area where S.A.F.E Dentistry, I would say, is extremely strong in terms of educating how things should be. Joan is fantastic on policies and procedures. I actually had, I thought, very evidence-based policies and procedures in our binders, and I was a little bit proud to show these. And actually, Joan, you know, instantly and politely, you know, correct, actually, these are not the evidence-based documents, and that this is actually not something that we should be, you know, relying on. Just even the way that the team members would maybe be, at that time, this was way before COVID, how they would wear their mask, or the personal protective equipment, certain things like that. So these are different things. She's really great at working on workflow. We've got video cameras in our office, so she's able to watch us remotely. These are wonderful things that dentists and dental owners can be rest assured of having S.A.F.E Dentistry kind of in their office, out of the office. It keeps them doing dentistry. It keeps you being productive and doctor-patient focused, while allowing S.A.F.E Dentistry to enable your team to just make sure that those systems are working properly. Education is huge. I would have to say what also sets our program apart is it really is a training program. It's not just getting ready for an audit, getting ready for Joan to come in. and then getting your results. It's an ongoing process. And we're really big on that. We're in constant communication, whether it be biweekly, monthly, and we really like to customize things for dental offices. So if you're a little 2-operatory office or you're a 6-operatory office, we definitely can be very flexible for that. If we could go to slide 6 there, Sharky. My office is after COVID. Gosh, we just opened our 3rd office this week, our downtown one. It's one that's in a medical building with an elevator. So I chose to open that one the last. But definitely things that we've implemented, and I'm happy to share anything to help other dental offices, when they've signed up, just so that you've got that collegiality. But digital screening is a huge one. We on our website put on a chat bot that we can use that actually does the COVID forms. It's a fantastic thing that I would recommend for any dental offices, because it's got a text crypted that you could put all those COVID forms versus your team, going through the email back and forth and scanning forms, etc. In terms of the office preparation, this is a huge thing, actually. So maybe there's people who are watching who still haven't opened their offices. And I found S.A.F.E Dentistry came in again for us just before opening. And we would do things like a Skype call, so that it didn't mean that I had to, block off patients or Joan had to travel or whatever. It was really effective. She would walk with our operations manager. She would ask us things where things were shown. I'm sure many people here have all done the air quality improvements and gotten your HVAC reports, and I've learned a lot about aerosols and air exchange, and all kinds of various different things. And if anything, it's going to make our air quality of our working spaces better. But what we're all sort of thinking about as well is the second or third phases, when or if those come, and having our offices safe for those kinds of things. Cleaning is a huge thing. I know Joan often, brings us back to the basics on the hand washing and just making sure that we're doing things properly. So it's so secondhand nature, but cleaning is a huge thing. Our turn down time, how we're cleaning. And, maybe something for conversation at some point later is, how do you know your staff clean a room properly? How do you know they've done it all? All of those kinds of things. Wouldn't it be great to have somebody on the outside actually just kind of do a random audit for you, just from the, maybe comfort of your living room or something like that, so that you would know how those things are done? We use all kinds of different innovative technologies that I even use in my own offices that just make us better and make us safer. And we're all about efficiencies, because I can completely understand a lot of this is or can be expensive in terms of all of the extra additional costs and investments we have to make into our dental offices. But if done innovatively and smartly, it can actually run your operations. It's pretty turnkey. And just the feeling of patients are that they feel extremely safe in the office. The team feels safe in the office. And so I credit that to Joan and S.A.F.E Dentistry for helping us with that. I'll be quite frank, I don't think I could have done it. I know I could have done it on my own. And so now more than ever is an amazing time for dentists to take this opportunity. And the last slide that I'll speak to, Sharky, is slide 7. And Joan can also sort of chirp in here in terms of the program. But basically, what I like to think about is it's kind of like a 3-year sort of program. In other words, you get your team signed up. There's all our information on our website. Please take the opportunity or email us afterwards or text us or whatever have you, so that you can kind of understand how our membership works. But it's not just, like I say, once every year, an annual thing, and you get ready and then everybody goes back to their old habits. This is an opportunity to really sort of change the path, change the way that we're doing things. And things like our online videos or phone calls or different things with our infection control officers, with the principal dentist, with the associate dentists. Joan has made all kinds of amazing reports, information. She's a fantastic person in terms of articles and evidence-based research. As we can all appreciate, this is very fluid. Everything is changing. We're trying to get the best research, the best information, evidence-based data is definitely in our wheelhouse, and we want our dentists at Dentistry to have all of that, so that if you're in the program, you really are part of something very good. And for us anyways, one thing I realized was that some of my offices were a little bit easier to train than others. And again, that depends perhaps maybe on the staffing that are there or some of the issues, but I've really learned a lot. I am here with extreme enthusiasm to just explain how I think, you got to try it, you got to sign up, you got to experience it, and I want your feedback because it was made for us, for dentists here in Ontario. And I give the floor over to Joan, and thank you so much for listening.
Slides, you can move on to the next one, please. Can you hear me?
Yeah, I just unmuted you, so we missed the first part of that sentence.
Oh, okay. I just said you're doing such a great job with advancing slides. I'll let you proceed, so you can move to the next one, please. Okay. So first of all, I'd just like to thank everyone for taking the time this evening after everything that's happened to spend the evening, probably a busy day in the office, trying to do all the things that Natalie's described, the stress and all the details and uncertainties with COVID. It's been pretty exasperating time, and who knows when the end's in sight. But all we can say is we're in it together and we can help each other. And this Safe Dentistry program is what we're trying to offer to help minimize the stress on everybody and make sure that your staff, your team, and our community, patients, and everybody remains safe, and we can win the battle with COVID. So I'd like to make just a brief disclosure here saying that both Natalie and I'm not going to make it a research presentation by any means, but any information that we pass on is basically to our best interest, that it's current knowledge, it's research-based as much as that can be at this point in time. To be honest, I have not found any documentation where it's saying that there's anything for certain with COVID. It's changing by the minute. So whether it's talking about aerosols, whether it's talking about the mode of transmission, it's all here, there. Yesterday's something, today's different, and tomorrow it's back to yesterday. So we just have to join the roller coaster ride and do the best we can. Having said that, I feel that the best path that we need to take, dentists, and I believe everybody in the community and world at large, is we have to continue to work on and focus on things that we do know for certain. So when I talk about further on in our slide presentation about what we can do and what Safe Dentistry has to offer, we'll touch on those bases. But before that, I'd just like to follow up with what Natalie says. This slide talks about the second phase of our Safe Dentistry program, which is, I feel, very exciting. And I talked a little bit with Sharky before we started the live presentation. And this is unlike any other company has to offer. This membership program is unique in many ways. And this is, I feel, the most beneficial aspect of our program overall. As Natalie mentioned, doesn't matter how big or small your office is, we can help, we can customize our programs and work with you. But the biggest advantage is in what I found as a consultant in surgery programs across Canada was identifying where the champions were, where the center of excellence are. And those individuals were more than happy to share that information with me and allow me to be a liaison, so that when in the end, it wasn't all about the consultant who sometimes is not seen as a welcome person in an office, but we call ourselves the friendly coach, not auditor. And what happens is that we develop a network, we develop a community, and we allow, through web posting, emails, blogs, training, as you say, community chats, and a variety of other communication devices, allow the dentists in Ontario and further to communicate with each other and mentor each other with Safe Dentistry as a contact to help answer any questions that they may have difficulty with and so forth. So the community membership has tremendous benefits. And as I said, it's not just a one-shop, one-time thing. we offer it over a 3-year program because we all know that it takes a long time to change cultures in offices and to change practices and to understand the importance of IPAC, infection prevention and control standards, and what they really mean. I find that not only in dentistry, but anywhere in healthcare, once that there's some regulatory body, whether it's your governing professional body, whether it's the Ministry of Health or Public Health or whatever, we find that we want to resist anything. And really, we need to embrace these IPAC standards and practice guidelines to ensure that we are providing safe care. But the other thing is there's an advantage to that it's the old saying that if you do things right, it's easier than not doing them right. And there's been a lot of effort put in from many stakeholders to develop these. And again, I was speaking with Sharkey. Dentist offices are not unlike surgery theaters. You're doing very extensive invasive procedures now that weren't done years ago. And you really need to follow, especially with the reprocessing and sterilization that takes place in an office, your miniature operating room theaters, and therefore the guidelines that are in place for surgery programs are in fact applicable to the dentist office in most cases. Next slide, please. So just a little bit of background. A lot of my presentation is going to be very rudimentary, fundamental, kind of baseline stuff, but I think this is where, if there's any weaknesses in the lines of transmission of diseases or microorganisms or pathogens, it's at the fundamental baseline patient protection. So transmission of microorganisms, before COVID, we were always focusing mainly on contact, which we always tend to do. Contact is just touching things and using your dirty gloves and touching the light above you or reaching into a drawer 15 times to pull out an instrument that you should have had set up there to begin with. So anticipating, critical thinking skills are all part and parcel of keeping a tidy, safe office. Vehicle transmission, that again, that's what is explained by its bloodborne pathogens, which typically are through hepatitis and HIV, and what we typically always focus a lot on. But since or after COVID that we've talked about now, we're focusing more on what we consider contact. Again, the fundamental one, touching things with dirty gloves or dirty hands or not washing and cleaning between patients. And then the droplet transmission and the potential airborne. So again, back to what I said, I have not found, and been reading daily, hourly, there still has not been any confirmed evidence in research. It's being applied, but not to determine exactly how COVID-19 or the COVID virus is being spread at the current time. So in order to keep us safe, we fall back on what we do know. Contact, we can control. Droplet, we can control using masks. And airborne, well, we talked a little bit about that, what we can do with masks and air ventilation systems. Next slide, please. So hand washing, hand hygiene. This is something that it affects everybody, everyday life. I'm married to a surgeon, and I'm an operating room nurse by trade and then an educator. So you can just imagine what our house looks like. We have everything in line. It's just like a mini operating room theater. You don't touch this and put things in their place, and cross-contamination. So this is my life, and it works well. In dental offices and in a lot of all the other clinical settings that I've been in. And the main reason that patients have infections due to cross-contamination is basically inappropriate hand hygiene. So implementing a hand hygiene in your dental office sounds pretty simple and almost like we already know this, but you'd be amazed. We have 4 sides to a finger, and we have 4 sides to your hand, and we have to do this and we have to do that. So it's important to look and make sure that your policy and procedures include full coverage of what a hand hygiene program is. I did a little bit of research that I just thought I might bring in here that talks about the use of alcohol-based hand rub. And it was very interesting to me because we're really depending on this a lot in this COVID epidemic, and we're not doing what we need to do. We use way too little. You have to use at least 3 milliliters or more than a half a teaspoon, which is basically 2 full squirts of a bottle. You have to make sure that that bottle is actually a registered number that Health Canada has recognized as being an appropriate hospital grade hand alcohol-based rub. But even having said that, people don't, again, apply it to all surfaces of their hands. They don't apply it long enough. It needs to be coverage completely, and also it has to dry. You can't wipe it away. It has to dry, otherwise it's not effective. Even if you apply it correctly, 90% of the time, it does. People, with just a study that was done in the research in Germany, and they used ultraviolet light to look, and they found that even with applying the hand rub and people trying to follow the hand hygiene program, less than 10% achieved what was considered to be appropriate cleanliness of their hands. And the 3 milliliter squirt is based on a small hand. So you can probably double that for medium and large hands. So people who walk around with a 2 milliliter bottle in their purse, or it's sitting at your maybe reception area, if it's not a huge bottle and you're not emptying that a couple times a day, I would suggest that you need to look at your hand hygiene program.
I just want to add one little thing there, Joan. One thing that we've noticed as well is as patients are coming in, one of the first things they're doing is using the alcohol rub. And if you notice, not one patient will ever use the 2 squirts. It seems to me that they use the tiniest little amount possible. And so this, again, you can listen to your team members coaching your patients, because they're the ones coming in from the street or wherever have you and touching things or not touching things. It's just really important that, as Jonas mentioned, for the team, also for our patients. And then the last thing, of course, the patient does alcohol again. So
yes, no, thank you. And I think that that's important, because you're on the clinical side of this, and that's exactly what I'm trying to drive home here, is that, this is the first line of defense, and it is not being paid attention to enough to make sure that we're doing it properly. And, it's like the weak link of the chain. If this is it, as soon as those people walk into your office, they don't cleanse properly, they're distributing all of their bacteria and viruses and things throughout your office. And it's hard enough to keep track of what is in there, let alone what you don't know is there. Quickly talking about sink placement. This is in the standards, the IPAC standards, and I'm sure everybody's read those, but it's important that you're not multi-purpose using sinks. There should be a designated sink for your staff to use that is for specific hand washing, hand hygiene, not the sink that you use to wash dirty instruments or where patients may or may not be utilizing those sinks. So if you're constructing a new building or a new office, these are things that you need to take into consideration. Or if you're working with an established office, you need to think about your sink placements, and if you actually have sink placements where people can wash their hands, because it has been identified that washing hands with soap and water is much more effective than using the alcohol-based hand rub. And the last I'll say on that is, when you use it, it only lasts for less than 2 minutes. And it doesn't kill bacteria. There's not one that's been identified through Health Canada, again, that, to my knowledge, that kills bacteria. All it does is, back to the old saying, it reduces the risk of transmission. Okay, next slide, please. So this, again, this is, I would say, the number 2 most important part of contamination and transmission of infection, COVID, or any other type of microbial transmission in a medical office, and it's your personal protective equipment. I'm not going to focus on all of these, but there's one in particular, a couple of them, that I would like to just talk briefly about. Number 1 is masks. I don't think there's a good understanding really about what a mask is. There are 3 different different types of masks that can be used, how it's used, what it's used for, what the purpose is. You know, I see them hanging around people's neck, hanging off their ear, tucked into their pockets, all kinds of different things. And originally masks were designed to protect the patient from the healthcare provider. But times have changed now, and it's a multi-dual purpose. It protects the patient from the doctor or the staff, and it also helps the staff against the patients. But the thing is that we need to use the appropriate mask for the procedures that we're doing. So quickly running through, there's American Society for Testing Materials. It's called ASTM for an acronym, and it's used for medical materials and deciding what's effective for the purpose it's going to be used for. So mask classification and selection of appropriate mask is very important. In the dentist office, you can use level 1 through level 3, and then obviously the N95 respirator. But you need to understand when it's appropriate to wear them. I know we've been kind of scared to death that we're wasting equipment and you shouldn't do this and you shouldn't do that. But again, it goes down to the fundamentals of what you're trying to achieve. And level 1 is basically what we call the procedure mask. It's the one that has the little loops over the ears. It's considered to be used in a clean environment. So it's not very effective. It's a low barrier protection. It's considered to be useful for what we call biological aerosols. And these are microbials that measure anywhere from 0.5 to 3 microns. They're the ones that are transferable through usually just talking and coughing. So the application of those are somewhat limited in the dentist office, but they can be used when you're doing basic dental checkups and so forth. Level 2 and level 3 are what we call the surgical masks. They're used in a sterile environment. They're the ones that we usually see that you tie up and tie back. They fit closer to the face. They are more resistant to moisture. So again, level 2 and level 3, it depends on spatter or spray that comes from the patient's procedure. You would choose to wear that type of mask. It has anywhere, though, from a 10 to a 90% effectiveness rate, and that depends on the manufacturer that you buy your mask from. So you have to be careful that just because it says it's level 2 or level 3, you really need to do your homework and make sure that you're getting kind of the top of the line of those versus the bottom. And we've already run into that issue with our government procurement session where we're bringing in millions and millions of masks and they're not effective. So you need to pay attention to what you're purchasing and understand the difference between the level of masks. The next one is to do with obviously the N95 respirator mask, and I think this too has been driven home enough, but they have to be fit tested. So you can't just go and buy one of those and say one size fits all. You need to hire a consulting company that actually does this type of fitting for you. And it is a procedure, but it's an important one. And you need to decide what types of masks are going to be appropriate for the type of staff that you have. Type meaning small, medium, and large people, to be most effective to prevent them from being contaminated from aerosols or spatters and sprays. The N95 respirator masks are not good for anything that has to do with any moisture. So you've probably heard too that they're asking to double mask, and that's just to preserve your N95 mask because there are a shortage of those, or there have been, but also it allows you to preserve them and protect yourself again because it doesn't have the water resistant protective sheetings in the manufacturing process. Lastly, there's 4 things that we call are the 4 F's for masks. It's a filtration rate. Again, I talked about that, whether it's level 1, level 3, or the N95. Fluid resistance, again, you're not going to get that in all 3 types of masks. You need to do your homework and determine which ones are effective and appropriate for the procedures that you're using. Features, again, you need to look at, that's the 3rd F, and that has to do with the proper wearing of the mask. It has to cover the nose and the mouth, and it has to stay over the nose, and it has to fit tightly as possible around the face. Now, some of the surgical masks do fit that way, but again, depending on the procedures, if there's laser plume or any smoke or type of evacuation in your aerosols, then you need to probably don the N95 mask. It's just important to just for exposure, but I thought this is an important thing to point out, that bloodborne pathogens is one of the top 5 causes of injury among healthcare workers. So wearing or double masking, if you're going to do a lot of procedures that are creating the aerosols that you're trying to prevent inhalation of, but you also want to still remember that that's not effective against the spray that's a water, and that can penetrate those masks and make them completely ineffective. Next slide, please. Challenges. Natalie touched a little bit this. This is just a little recap about things that I find when I do my family audit of the dentist office. Record keeping is one. Record keeping mainly in what needs to be documented in terms of sterilization process. There's parameters, which I'm sure you're all aware of, but manual logs are very labor intensive and often are not completed properly. So it's important to assess what you're doing in your office. There are some nice advantages to looking in the marketplace for certain types of enhancement availability equipment to help improve your record keeping. So that's something perhaps you could look into for the parameters of sterilization. Reprocessing equipment and the instrumentation. This too was an area where in the hospital, for example, people are specially trained. That's all they do. And it's a very labor intensive, very high skilled area. And I think dentistry has come to the point now where some decisions have to be made as to what type of allocation of resources, education, and monies are going to be put into the reprocessing of equipment and sterilization. It's a huge factor center in itself, and it is a serious weakness in the dental area environment. Care and storage of sterile items. I can't stress this enough. After working in an operating for so many years, that I walk in and I see, drawers jammed that are sterile instruments, and they're all jammed in there, and the integrity of the packages, well, who knows what it is. We don't know when it was put in there. We don't know if they're torn. We don't know who's looking at them. So again, it's a big process. It's a big area that needs to focus on and have a lot of attention paid to. Staff education, as Natalie talked about a little earlier as well. We're so busy every day trying to just keep up with the everyday activity and providing services. That education, we think, how do we ever have time to do this? Certainly during COVID, I think people have picked up a bit and had time to do some very serious education, getting acquainted with the internet and some of the modalities that are available to educate oneself and not have to spend a lot of time at it. So YouTube is a fabulous thing. Public health has a lot of information, CSA standards, there's all kinds of things. But what, again, for our members of Safe Dentistry, we'll bring all of this information together and have it a one-stop shop for you, so we can help you kind of filter through this enormous pile of paperwork and things that you need to focus on, and look at your office and determine where you need to start, put your emphasis on, and try and staff education is an ongoing process, just like auditing or IPAC standards. We have to focus on them on everything that we do. They have to be part of every decision-making process that we have. Every action has to be based on evidence-based practices and on education, as well as making sure that we're keeping our patients safe. And continuous quality assurance, this is something in offices too that doesn't happen, because everybody, again, we appoint the infection control person, and then that person has a full complement of patient care, and there's no time for them to do their continuous quality assurance. There's no time for them to educate staff. There's no time. So Safe Dentistry, we ensure and help dentists and their team figure out how they're going to change and manipulate their schedule so that they actually allow time for this process to take place. It's very important. You cannot have a safe office unless somebody's constantly monitoring and mentioning and watching what people are doing and how they're doing it. New staff, old staff, we all get, complacent in how we do things. So it's very important that the offices focus on this kind of thing, as well as providing the services to their patients. Next slide. Okay, after COVID, the things that are I find here is, again, as I mentioned earlier, there's nothing that's written or nothing that has been determined in science so far as to for sure with COVID-19. What we're finding is there are a lot of false negative testing. So if people are tested, and this goes into your screening programs in your offices, false negative, somebody may come in and say, I thought I had COVID, but I had my testing and it was negative. It's unfortunate, but that is really a difficult answer or finding for that individual as well, for you as a dentist to deal with these people, because it's like the same thing happens with tick bites and people with Lyme disease. The bacteria or the virus has to be in the body long enough for the body to produce antibodies, which is in fact what provides a positive test. And if it's person's tested too soon, it's going to be negative. That person's going to come into your office. So your screening process is very important, and to understand that right now there are more false negative testings than there are positive, from my understanding of the testing modality. They're starting to focus on looking at antibodies, but again, there's so much problem with the screening test and the blood work and the process itself that it's not reliable enough to have any positive impact on screening patients at this point in time for dental offices. Patient care, obviously, you're going to have to decrease your volume, and I won't get into that, but that has a serious impact. You've been closed for a couple months now, and decrease in volume, having furlough time for your operatories is a decision that you have to make, whether you're having changes in your air quality or purification systems, and all of these big decisions and fairly financial taxing decisions that you have to make. And at the end of the day, there's still not any real evidence to help you direct to make your decisions on what you should and shouldn't do. So we have to, again, as I reiterated before, is stick to the things that we do know: environmental cleaning, personal hygiene, the hand cleaning, the personal protective equipment, and all of that type of thing has to be top of the line to ensure that you're carrying out the best practices that you can with the information that you have. Then finally, we get down to, as time progresses, dental offices, as well as many other medical offices, paper is our own worst enemy. It just starts at the reception desk, and it gets passed on through numerous hands, sits in the dental office where the aerosols and everybody's handling and moving around, and then it gets passed around. So it's a real problem with transmission. So it's time where offices need to start looking at how they can implement paperless files, looking at other digital data management options, as I mentioned earlier, for the parameters of your sterilization that you need to log and record for by regulation. For 10 years, you have to keep these in storage. You need to be able to do tracing of your instrumentation and all of these difficult things. So if you can look at digitalizing your management options, it will make your life easier. If in fact you have a recall that you have to start to trace where that patient is and any exposure to your staff or other patients on any given particular day. So these are things that you should be thinking about moving towards. Everything costs money, but in the end of the day, if you are found to be lapsing in any of the IPAC standards, the publicity is damaging enough. You'll have to hire lawyers, and you'll have to do this and that. So a bit of preventative medicine always goes a long way. So this is your opportunity to take advantage of a great team that I think we've put together. information that's easily accessible, up to date, and an environment that we can encourage dentists to work together to improve their profession and be perceived as a safe place for patients to continue receiving quality care from the dentists and their team. Next slide. How you can reach us. This is our website. We invite you to come and have a look and see what we've got posted on there. As we continue to increase our membership, information will be increased on the website. There is a login area there that is only available obviously to our members, but you can see what's behind the hidden door if you become a member. Also on our website, we have a little survey that would be worth your while to take. It takes less than 5 minutes, but it'll give you an understanding of perhaps some of the things that you need to be thinking on a wide base pertaining to infection control in your offices, and where you stand and whether you really feel or see that you're complying with all the standards that are there, and things that you need to be considering going forward. Is your office really safe for your staff and for your patients? Next slide. So in closing, Natalie and I, Dr. Archer, we appreciate you sharing your time with us tonight, and thank you very much for listening to us. And please visit our website. You can contact us through there. We'd be more than happy to share any information and give you some advice and help answer questions. And we will be offering answers to questions at the end of this seminar as well. Thank you.
Okay, thank you for that, Joan and Dr. Archer. That's great. And everyone that's watching, please, if you have questions, put into the chat area. Don't be shy. Anywhere from YouTube, LinkedIn, Facebook, even Eventbrite. I'm not sure that questions or comments in Eventbrite, but please post it there as well. We got quite a few people from Eventbrite that signed up. That's good. But so as we're collecting questions, I think the most important question that we have is, what animal was that in the background?
In my background?
You've got those drones.
It was a cow.
It was the cow. Okay. I think Robert. Hi, Robert. I think Robert got that right. It's a cow.
Now that was the #1 question on our quiz. So whoever asked that question, we have a special treat for you.
Perfect. Great. Okay, so some questions are coming in. Just going through it right now. Perfect. So what's your overall prediction for dental offices within 1 to 2 years? Do you think this will persist, or what direction you think kind of the regulations will go?
Sorry, what's the question?
Like, what's the prediction for COVID for the next 1 to 2 years? Like, what effect will it have on the dental offices? Do you think we'll be set, or you think things will change as we go?
Well, I mean, that is the crystal ball kind of question. If I was just asked to give a hunch on how things are, I think if we have an environment which is safe and evidence-based in terms of going to, I would think that in an evidence-based safe environment, you would continue to practice, I would think. I mean, the regulatory guidelines are put out there so that we're able to treat COVID-19 patients. If you read them, a lot of us choose to, and you have to assume everybody has it, which is why we're all PP'd up and why we're doing things. So I think that's my sort of short answer. Joan, how would you want to answer? I mean, I think maybe another way of looking at it is, I don't know if the scariest times are behind us or the scariest is to come. But I think that's why this is so important now, is if we're a little bit lazy or we're just not doing things properly, if we look at healthcare workers, they often get infected because of something that they've done incorrectly themselves, whether it be touching things or different things. So that's what makes it so high risk. And we have to remember that although dentistry has been, practicing for many, many years, and we've been doing an amazing job. This is a really good time to set ourselves back and reflect, why are we doing this? Why is it that we need to do this? You know, and because of the difference of jurisdictions and different guidelines, it's been really confusing for health professionals and team members to know what's the best thing. Joan, do you want to maybe put a little comment on what you think?
I agree totally with what you've said, Natalie. I think the thing that we need to be sure of is, as I've mentioned earlier in the talk, as you said, most of the time when there's cross-contamination, it's done through just pure lack of following appropriate policy and procedure. So if we look back even at all the other risks and types of infections, as we talked about, hepatitis, TB, what have you, usually there's a break-in technique that causes the contamination. So if we pay attention to detail and we know that there's a high risk that this is a very high contaminating virus right now, we don't have any vaccinations, there's no treatment for it. But on the other hand, we have enough knowledge that we can continue to try and do things that we know for sure will make a difference. And back to that, we need to do those things well. And as the science progresses and we get more information, they're not sure right now as far as aerosols, which is a big thing in dentistry. There hasn't been any real confirmation that the viruses is actually spread in aerosols. So we just need to take one day at a time and do the things that we are confident are going to make a difference and ride with the tide. It's going to depend on the community. In Kingston here, where I'm from, we're going to our third stage opening on Friday, where the public's opening up. I think I live my life in 2-week blocks anymore. I think, okay, we got through that last one. We're looking now, we're opening up more. I just wonder what's going to happen in 2 weeks. If we get back through these 2 weeks and we haven't overloaded our healthcare system, then we need to look and see. I think things are going to be positive, and we need to focus on the positive, not only for dentistry, but for our individual well-being.
Okay, great. So let's take our next question here. How often should you train or check your staff? I guess how often should you train your staff? Because as you say, they make most of the infections caused by mistakes that staff make, right? So how often do you need to train them to really get them to behaving correctly?
Mm-hmm. Well, I'm just going to sort of answer from our sort of thing, and Joan will correct us, but definitely, and I'm looking at COVID, we definitely all did a training before COVID, before the offices were reopened, with all the new changes, reviewing what we did before. We did a lot of demos and different stuff. And what's amazing when you're training your team, or what we found, is it wasn't just reading something, getting something to do. It was, we put the PPE up there and we said, Melissa, could you show us donning? Of course, everybody's like coaching or different stuff, but it was interesting. Or the doffing or different things. We try to do at least once a week, even if it's a 15-minute session of various different things. Each of our offices has an infection control officer. Sometimes it's usually a hated role. It's not a popular person. And so S.A.F.E Dentistry has been an amazing crutch, because now oftentimes it's Joan that's been able to be on with the training calls. So now the infection control officer person has Joan on the team. The team knows, this is the best practice. This is what we're supposed to be doing. I'm the officer. I'm kind of doing that. Before S.A.F.E Dentistry, I suppose I, as the dentist or the employer, was supposed to be getting my team to do this. It's really hard to do all that. So, and then Joan will kind of explain maybe some other timely stuff, but we're really hoping going forward, COVID onward, that this training, this infection control is definitely very regular. Bi-weekly, we like to do audits, quizzes, we find out what the deficiencies are, monthly things, and we use WhatsApp, different Joan, any other comments?
No, I think that's right. Part of the recommendations when I'm in an office on the part of education is that it's critical that the dentist realize that it's the dentist is the ultimate responsible, the owner of the clinic. And if they don't take this seriously and allow their infection control person who is liaisoning with Safe Dentistry to have appropriate time to assess what needs to be refreshing, it's an ongoing thing. So it's not how often the training should be. Training should never stop. Every staff should change the way they think, and when they do something, their mind should be saying to themselves, am I doing this right? Why am I doing this? What does this mean? I don't know what I'm doing. How do I find out what I should be doing? Who do I ask? So it's like, hospitals, we would do audits every 3 years, and we know the Ministry of Health would say, okay, your audit's coming on, July 24th. And we literally stop clinical practice and fix up our manuals and do everything for the sake of the audit. And it's like, at the end of the day, someone like myself, who's an educator who had to do these monotonous chores, would say, like, what's the point of this? We're supposed to be providing good quality care. This shouldn't be a hard thing. It should be improving our ability to provide care. So there's a whole change of mentality that has to evolve in the dentist office, as well as to say, infection control is our friend, and we want to stay on top of it. And there are people, Safe Dentistry again, and the community of Safe Dentistry, we can work together, and it's not going to be this negative connotation of we don't want to do this or we're doing something wrong. We're all just trying to, raise the bar and provide good quality, safe patient care.
Great. Do you just want to give a kind of quick summary of what happens when they sign on with Safe Dentistry? What exactly do you offer?
Okay. Well, what we start with is actually signing a contract. And we start out, originally we were doing some on-site visits, but with COVID, and we were moving towards this anyway, because as soon as you have to incorporate travel, it increases time and it decreases productivity. So we've developed, we would do our audits using a platform like Skype or Zoom or what have you. But what we do is divided over it's basically the full audit would be a 6-hour process in 3 2-hour slots. And what that will do is just break the audit into various components of the dentist office. Once that's done, take that information, and we have online tools that we use and handheld devices to just determine whether the office is compliant or non-compliant with the particular IPAC standard. Once that's done, that information is taken, processed, and a report is generated with recommendations handed back to the dentist and the staff to disseminate the results. And we move towards the implementation and changes of the dental practice and what we can do to improve the compliance with these standards. So that all takes place roughly, the office is given a certain amount of time, a reasonable amount of time, just, it depends on the size of the office and the number of staff, but probably 4 to 6 months. They get make these improvements so that they are compliant, and then we provide them with what we call as our membership. So at that point in time, the dentist can put a plaque in their office, as well as the associate dentist, as well as the dental hygienist, and all the staff members can post to the patients, which is very important, that they've taken that extra step, that they are, wanting to provide the best safe care possible, and that they are a member of the Safe Dentistry program. That has a lot of weight, particularly now as patients are very educated. They're very afraid to go into dentist office. So I think in the future, moving forward, being a member of Safe Dentistry program is certainly going to be an advantage for dentists recruiting new patients and retaining their old patients. So once that's done, again, there's a continuous communication line with the dentist office and Safe Dentistry. And we offer online programs. We, deal with individual customized programs that they may need, have community forums, sharing education sessions that we can provide that, the team or the community feels necessary. And so it just works as an extension of the office, that we lead the infection control and we help to support the office in any of the challenges going forward and making sure that they are compliant with the industry standards. So after the 3-year membership is up, they have an opportunity to renew the membership. If a dentist finds that it's a too onerous problem, or that they are not willing to make compliances, changes to their practice, and they don't meet the standards that S.A.F.E Dentistry has identified using the professional standards, they don't remain members of our program. We have a high standard in our program, and we want to make sure that the people and the dentists and the patients who are associated with S.A.F.E Dentistry are in fact getting a high level of care, the best care possible. So we have standards that our members have to maintain in order to maintain their membership.
Great. And then, so what's the alternative? If they don't use the use your program, S.A.F.E Dentistry, how else are dental offices going to stay up to compliance?
Oh, that's a great question. Natalie, you go ahead.
Well, I got to tell you, it's difficult because somebody's got to do it, and everybody seems to have a job within the dental office. Usually the infection control officer plays another role of some sort, in the dental office. So in the past, and even currently, infection control kind of gets squeezed. Well, I'll do it in my, downtime, or you carve out a little bit of time. So what S.A.F.E Dentistry really has done, and like I say, the COVID in a way has kind of really brought it out, but, it allots a specific time where, we really go through the training and the various different stuff. So I have to say, since our first office opened for emergency care only to current now where we're doing comprehensive, it's a huge change, I find, in terms of the way that the team works together, the expectations, we don't, all of those kinds of things. So I just think we've just really upped the excellence, really upped the excellence, and I'm just really proud to see it.
Okay. And then what percentage of practices do you think actually meet the IPAC compliance standards?
Mm-hmm. I would say none. I can say that confidently. There are weaknesses, whether they're, minimal, but I don't think any standard that is not met completely is an opportunity for cross-contamination. So, whether somebody is lapsing in sterilization techniques, or whether they're lapsing in training, whether they're lapsing in cleaning, it really doesn't matter which standard. If they're weak and for whatever reason are not meeting the standard or not able to comply with the standard, they're putting their staff and patients at risk. It's an all or nothing situation, and we're all human, and we all make mistakes. We all have different interpretations of how things are done. We all have different levels of knowledge and background. So it's an evolving thing. It's a complex and it's difficult. Nobody's going to be perfect, but what we're trying to achieve here is to reduce the risk as much as possible and increase awareness and education. So that's the only guarantee that we can do, is to facilitate that in the dentist office.
Okay. Great. So I have a question here. How long can you use the N95 mask?
Well, let's put it this way. If we had unlimited supply, you would use one on each patient, and you would probably change it depending on the length of procedure that you were doing, the condition of the mask. If you didn't wear, say, a level 3 mask to protect it from any wetness, there are so many different parameters that there's really not a real answer to that question. But all I can say is, because of the shortage, we in our hospitals, for example, have been asked to wear them long past their due date, in the sense of what they're to be used for based on manufacturer's recommendations. It's like a single-use item, something that we look at as well. It says single use, that means single use. In this particular case, unfortunately, our world was pushed to the limit to say, we have to change that. We have to say, using a contaminated or reprocessing of N95 masks has been something that has been unheard of, but in some cases they felt it was better than nothing. Me as an epidemiologist and infection control person working in an operating room, I'm not so sure I'd be wanting to wear the same mask all day long. I find that really, because even now with masks and not proper handling them, they're very contaminated items, and we have to be careful. We have to follow the manufacturer's guidelines. We have to follow the guidelines that are available when we have PPE that is limited access. So depending on what each office has, they should be very particular in using their masks appropriately. Don't be using an N95 mask when you can use one of the other level masks. But again, you have to know why and when it is appropriate. So it's an individual. There's not an answer for that you can say an hour, 2 hours, or a day. It really depends on why it's being used and how it's being used and what exposure it's had.
Okay, great. So we have a few questions here, but we're running out of time, so just take me 1 or 2 more questions here. So how did the pandemic affect the design of dental offices going forward?
Well, it's interesting. At some point in the 70s or 60s, dental offices were all individual operatories with ceilings, walls, and doors. And some person at some point came up with the open concept idea. When you think about it, I don't know exactly when that happened or really how it could happen, considering, all of the sort of things there. I think, one of my offices, we're actually just designing the second floor now. And I'm going to choose to actually do individual operatories with doors, different things for the pandemic. Probably wasn't a pandemic, but we had it all open concept. So that's colors or the air filtration system all away in there because these whole things in there. Joan, any other? I think also now we're working about administrators in our office. Our administrators are working remotely, and waiting rooms. I wouldn't be investing a whole lot of space in a waiting room. There's no more waitings. Quite frankly, I think a chair or two, which all my offices are all waiting rooms anyways, but that's a different design of how I would do things. Trying to think off the top there, but look at all of the regulations or risks in the physical environment, how we design things. So, yeah, Joan?
It's just like anything. There's transformations based on, the past, and hospitals are designed in the same way. We used to have hospitals that would have open wards where you'd have, anywhere from 2 to 10 or 15 people in one room. Infectious diseases have been paid more attention to. They're more contagious. And so the design of hospitals, we have a new hospital in Kingston that's designed, and there's 1 patient per room, and they all have 4 walls, a ceiling, and a door. They all have windows. They do have, isolation appropriate setups with antechambers for people to care for them safely. So, but I think the verdict's still out here on dentistry because we still aren't sure really what's going on, depending on what ventilation and where they determine from a research perspective the actual transmission through aerosols or through airborne will dictate whether, it's and the availability of sophisticated equipment. It may be dangerous to be, shut behind four walls and a door and having the room circulating in isolation. So I think we still need to wait and see where things are going, but certainly there's going to be a lot of consideration on how things are going to change and what will be the best setup going forward. But it's not only for COVID. There's going to be, this is just the beginning of the tip of the iceberg. There's already talks of different other types of infectious diseases that are lurking in the waiting. So we need to be wise and use this time now to go forward and make sure that we protect not only dentist office, medical buildings, and the community at large. So still a lot of learning, a lot of unknowns. So time will tell.
Okay, great. And then we'll finish off with a final question. What is the biggest mistake dental offices are making now, and what can they do to correct that?
I can answer. From an auditing point of view, I think there needs to be a fair amount of emphasis and focus put on reprocessing, sterilizing, and documentation. That area, but that's outside of COVID. That's just an area that is somewhat, as I said earlier, new to dentistry, to the volume that they're doing now. They are many surgery centers, and this is an area where they have designated, larger centers have designated people who are highly trained to do these types of procedures and policies and lining things up to make sure that things are done properly. But there's many areas of weakness, as I said earlier. When you ask the percentage of IPAC lapses that are there, it's all over the place. There's some concentrated areas, but it's an ongoing process, and everyone has to be looked, every office has to be looked at individually to see where their weaknesses are, or I prefer to say their challenges, and what we can do to improve that.
Okay. How about you, Dr. Archer?
Biggest mistakes? Well, I would agree with Joan, and I have to say, again, in dentistry, as the owner is responsible for everything, this is not my area of expertise. So, I just didn't feel that I had the skills to see whether something was done properly or not properly done, because these other people who are actually reprocessing the instruments did actual training in that. Dentists did not do any training in that. Dentists don't do training in infection control in terms of actually putting in their instruments and taking them out. It's kind of interesting, and we learned it, I think, with the first IPAC guidelines. We had the associate dentist, and I would give them the bag of which one was sterile and which one wasn't. And I looked at one another. You're so used to your system giving you the sterilized bag. Or, how many dentists actually open the Steri Center or close the Steri Center? These are interesting things. Yet we're also managers, we're employers, we're responsible. If an auditor comes in or a complaint comes in, we're supposed to be experts in this thing. So that's why this whole program is genius in having it, because it takes the weight off of us dentists to have an expert guide us, coach, discipline, remediate, whatever, bring to our attention what's going on. And I'm just so ever grateful.
Yeah,
that makes for this opportunity.
Yeah, that makes a lot of sense to me. I thank you, Joan Hutchins and Dr. Natalie Archer, for speaking to us today, and keep getting everyone updated. I want to take, and the link, if you want to contact them, is safedentistryinc.com. That's in the comments there at the top. And I just want to let you know about the webinars coming up next week. Next week is Dental Marketing Week. We have Alex Latin, a CEO of MaxiDent. He will be talking about how to be an online authority and attract patients. So he will guide you through the techniques you can do to increase your presence online. And by increasing your presence, you have become more of an authority, and you can attract patients, increase your bookings. And then we also have Blake Hadley from My Social Practice. Right now, the most important thing for dental clinics to do is to communicate with patients, to let them know that it's safe, that it's okay to come back, and you're taking the proper procedures. And the best channel to do that is through social media. And Blake will be telling you what to post, what should I post, that will help you reach more patients, build relationships, and build your reputations. And I've seen part of his presentation, and they're really good, simple tips. And it's very important for you to be focusing on that right now. And after this, you will be redirected to Dentistry Business, where you can register for the upcoming webinars, as well as check out all of our past webinars and watch them on demand. So thank you everyone for attending, and have a good evening.
Thank you.
Bye-bye.
Stay safe, everybody.
Thank you.